Bill to change how the state provides mental health services is advancing at the Iowa State House.
It's one of Governor Kim Reynolds' top priorities this year. Chief political reporter Amanda Rooker joins us, and she'll show us why Reynolds is pushing for more oversight and consolidation of Iowa's mental health system. Amanda.
Stacey Ben, the governor's office says the state's current mental health system is broken. Right now, there are two separate systems that oversee Iowa's crisis resources, one for mental health, another for substance abuse. Mental health resources are broken up across the state into 13 regions. Substance abuse is broken up into 19 regions. Reynolds' new bill would consolidate those two systems and create 7 new districts statewide. Each district would have a local advisory board. The state would decide which counties each district serves and what services they would be required to provide. The governor's office says that would help Iowans have better access to the care they need.
Iowans deserve access to behavioral health services where they live and when they need them. That is not happening today. Services are not consistent across the state, lending to service gaps and provider access issues. The regions have done the best they can with a fractured system, but now it is time to fix it.
And the bill says that the new districts would be live and fully operational by July of 2025. Some mental health advocates say that's too soon, and while some providers are excited about the changes, others have concerns.
They just don't know what it's going to mean to their workforce, to their funding, and ultimately their ability to maintain a continuity of services over the next 18 months and then into that first couple of years of the process. The timing to be effectively achieved, we believe, is too short. We're asking that it slows down, implement this maybe in phases.
Another change, behavioral health districts would not include disability services. Instead, the Department of Health and Human Services Aging and Disability Network would oversee those services. The bill did advance through subcommittee today. That's the first step in a long legislative process, so this still does have a ways to go.